Health Department says the fourth wave of COVID-19 is unlike anything we've seen before. The number of COVID-19 cases and infection rates has skyrocketed. But there's also been another development with the Omicron variant. Hospitalisations among under 5-year-olds is rapidly increasing. To discuss this further, I'm joined by Gauteng Education MEC, Panyaza Lesufi. Thank you so much for your time, MEC. We appreciate it. I just want to ask you, first of all, how worried are you that the younger population, those under the age of 19, are now testing positive for COVID-19 and are being hospitalised?
Thanks, Heidi. Thanks for the opportunity, and we really appreciate this opportunity. We are deeply, deeply worried, I must be honest, especially now that there's evidence that those that are aged around 5 years and above are also becoming victims of this new variant. We are only pleased that the schools are about to close in the next few days, and that will give us a breathing space. And hopefully by the time the new academic year starts in 2022, by that time we'd have pushed the number of vaccination of those that are above the age of 12, so that we can at least manage it utilizing vaccination. Now that majority of our educators are vaccinated, that also brings a relief of some sort. But we are indeed worried. We are following the statistics closely. We are monitoring the trends, especially the hospitalization. And we are also monitoring the trends of those that are above 5 years, so that we can check whether there is an urgent intervention that we need as an education sector. But we are deeply, deeply worried.
Sure. Do you think there's enough reason for parents to panic at this stage? Has there been a serious outbreak in any of the schools in Gauteng that we should know of that's cause for concern?
Data is not conclusive as we speak now. I think we're still waiting for experts to guide us and to give us the relevant information. And we welcome our province, which is Gauteng province. They've put up an expert team to analyze the data that we've just received in the last 3 to 4 weeks. From that data, I must say that there's no cause for concern. We really believe it's something that is manageable. It's only when it can get out of hand completely that will start to worry. But our experts are on top of it, and as soon as they advise us, we'll advise parents. So I will urge our parents just to remain calm, monitor the situation. As I've earlier indicated, the school calendar is coming to an end in the next few days. So our children will be released, and they will be in the care of the parents. And hopefully by the time we come back, early January, majority of these learners will be vaccinated as well, because that's the only protection that we can utilize. And out of that, we will monitor the situation. Gauteng has taken a progressive view that the vaccination of children must be accompanied by consent of parents. We're quite aware that parents are not necessarily required to consent, but we really believe everything that is happening within the school premises, we have been receiving the support of parents, and therefore we don't think this will be a different approach completely, and parents will continue to give us support and ensure that their children are given the necessary consent to vaccinate.
Given what the numbers look like, and given to your point where you say schools are about to close, do you not think this is a call and an urgency for schools to close sooner? We do know that the date is the 15th of December. Do you not think that looking at the numbers in Gauteng alone, the schools should have been closed already?
It's an option that is on the table, but remember the period that we're in is a period of examinations. It's a period of assessment. It's also a period of consolidation of the work done the entire year. So we don't want to be reckless and abruptly end the academic year and make learners to repeat the grades next year. I think it will be disastrous. We have to balance the two, and that is why we are saying where we believe learners have concluded the work that needed to be concluded, they can be easily released rather than wait for the 15th of December. But where they need to conclude the work, we'll speed up the process so that they can conclude that part of work as quickly as possible so that we can avoid this wave. And where we believe that the academic calendar needs to be reviewed, we'll be the first one to call on the minister to review that. But for now, I don't think there is a need for panic. We need to conclude this important component of any education sector to finally assess learners for their performance for the year and prepare them for the 2022 academic year.
MEC, let's move over to vaccinations. We do know that those aged 12 to 17 years old started getting vaccinated with one Pfizer dose a couple of months ago. How important do you think is it for those in this age group to heed the call to go and get vaccinated?
It's crucial. I think experts and evidence indicate that those that are vaccinated stand a better chance of managing the virus, and those that are not vaccinated, unfortunately, their numbers are high in terms of hospitalization and in terms of additional help that they need in terms of oxygen and hospital beds and other related matters. So we will urge and persuade and really push for those that don't have religious or any other reasons not to vaccinate, to really go and vaccinate. We believe our experts and our scientists have proven now worldwide that are the best, and we need to rely on their advice. So the advice is that let's go and vaccinate to protect ourselves, protect those we love, and protect the environment, and also protect the country. If we can do that, I think we'll be in a position to fight this virus in a better way.
Sure. MEC, I want to touch on something that the NICD mentioned yesterday, the fact that a lot of the young ones that are testing positive for COVID-19, when analysis is done, you find that either the father or the mother is not vaccinated, or sometimes in most cases, both parents are not vaccinated. Do you think a different message or a stronger message should be pushed about the importance of vaccinating, especially because young ones are now testing positive, and it's the unvaccinated population that's testing positive? The reason why I ask you this question, and you're probably wondering why, because it's not really related, you don't control parents, but a lot of what happens at home impacts what happens at school and with the young ones. So what kind of message do you think should be driven, especially with unvaccinated parents, and the impact it has on pupils?
Indeed. I believe in the power of persuasion. Persuade, and persuade. We need to persuade those that are not vaccinated, but it can be an open-ended approach. I'm one of those people that believe that South Africans believe in deadlines. So until the state put a deadline, say the 31st of December as the final deadline for people to vaccinate, we'll have this open-ended approach where people drag their feet to come and vaccinate, and we're wasting a lot of resources. Nurses are opening centers where people are not pitching up. You've got vaccines that is expiring. You've got facilities that need to be booked, and those facilities are not utilized. So the sooner we just find a way of putting a firm deadline, that by the 31st, as my example of December, that's the final day where we want people to vaccinate, so that we know who's prepared to vaccinate, who's not prepared to vaccinate. But we can't just have this open-ended, where we are pleading to people and we are not sure whether they will respond positively. I've seen one advertisement where people are even encouraging people to vaccinate so that they can get some vouchers or get some amount of money. I think we've done everything possible to persuade people to vaccinate. Now it's time that we set up a firm deadline where by this day or this date, that's the last date that we give people an opportunity to vaccinate, so that the country can move forward and we can know whether we've got enough people that have been vaccinated or not. But this open-ended approach, I really think is becoming to be costly, not only to the health department budget, but also to the country, because we don't know how long will we wait for people who don't want to vaccinate to come and vaccinate.
Speak to us about your concern about how Omicron is a lot more transmissible than anything the country has ever seen. It's pushed us into the fourth wave a lot sooner than expected. And I want to refer back to an Equal Education report that was released last weekend about how in the 9 schools that they studied, they found that 70% of these 9 schools and townships are overcrowded. It speaks to large gatherings indoors and how this is a breeding room for COVID-19. What is your response to this report about overcrowding, and how do you plan on tackling it, especially in an environment where we have variants mutating and spreading a lot faster than what we've seen before?
I'm concerned by our reports. We monitor the trends in our schools, and our reports are quite clear that schools are not super spreaders. Our reports are clear that we are having fewer and fewer learners that are infected with the virus, but that does not mean much lower guards. The issue of overcrowding is a worry, it's a serious concern, but we're paying the price for adhering to avoid overcrowding. Majority of our children are not coming to school. Majority of our children are dropping out. Majority of our children are not getting proper and quality education. And who are those majority? Are the poorest of the poor, who are at home because of the rotational program that government has adopted for children to get education. In some instances, children come 2 days in a month, and that's disastrous. It's catastrophic, actually. And we must not allow that. As long as our schools are not super spreader centers, we must trade carefully of not allowing children to come back to school. Actually, some of us believe that we need to prepare to ensure that children come back in full force around January, but obviously monitoring the variant, but also ensuring that majority of our learners are vaccinated. If we can achieve that, we can easily allow our children to come back to school.
MEC, just lastly, very quickly if you can, we do know that vaccination campaigns will be introduced at schools for those 12 and older. From your assessment, I know you've been doing these campaigns with the Premier in the last couple of days. Are people wanting to get vaccinated, or are people a little bit more reluctant because of vaccine hesitancy that we're seeing in the older age groups?
I'm not sure how reliable the statistics can be, but personally, out of 10 people that have gone through when we're doing door-to-door, of the 10, 7 are vaccinated, which to me is an encouraging sign that out of 10 people, 7 claim they're vaccinated and claim they will encourage other people to vaccinate. So to me, it's a powerful, powerful message. It's an indication that we are doing well. So what we need to do is to ensure that we get more people, persuade more people to vaccinate. I can assure you, I know how people feel about vaccination. I know how people feel about trusting government to drive this program. I know how people feel that these vaccines were rushed. But the reality is, across the globe, those people that have gone back to normal situation, if I can say new normal, they're vaccinated. You watch football in the UK, you watch football in other countries, people are back to normal purely because they're using vaccine as a protection. We can't be left behind. We have to move as quickly as possible to cover lost ground so that the economy can be fully opened. The artists, the music industry and other industries that are closed, that they can reopen. We owe it to them. We owe it to all of us to protect our country and ensure that everyone is vaccinated. And when we reach that vaccination point of everyone, we can be in a position to open the economy and go back to the new normal.